Atachin chitab Kalenjin ile me cheitune ngetesiet nebo Kass TV nesomanun kwane Shadrack atestai ak labatet en betutab aeng kipchulyo teklale rupe en dakinitab kokimit kobit ribetab kalyet en komosta noton nebo North Rift kongololi en kasanamu kotestai labatan amwa kole ibeljingei kobit ribetab kalyet en komosta nebo Elgeyo Marakwet, komosta noton nebo Singishu, Baringo ak komoswek alak kotestai kiboronji ngemetab kalyet.
Wangeta kutoka labatete tekla lorupe in 1994 in emetab America noton ko New York City 1994 ugi gineten Africa netu in batai nebo labate neten marathon e gabo nebo konyi ko batani be tamana ko labatin neten tekla lorupe in gold medal na ko silver na ko bronze ko baten labatin neten kaliet ne noton ko mukito labate nebo be tabamuti e ko mosa nebo Kakuma in Turkana West Turkana County age mitene be tamana Turkana Central in noton ko headquarters nebo Turkana County tawu tablo do noton kita unene be tabrane lamet iton en ko pasana bo Lodwar town ageta kinige ko pasana bo Kapenguria noton ko West Pokot noton ko kilometer sek pokolo en 16 noton ko to kinge neten tekla lorupe labatet ne bo kilometer sek pokol sit agartan ko ngeten ko musukiton Pokakuma o ko pasana bo Uhuru Park en gunu tap town tap Nairobi noton ko ko tit ne bo gergele kanyor kaliet bi kimiten en ko musukiton po North Rift ko to ko tit noton bo ribset tap kaliet en emitari misingeta kinige woni ci bo 2027 noton ko kamoneten tekla lorupe antawa ko ngala neten en ko pasana bo Lodwar ako maneten ko le tokkinge neten ko utit ne bagegergele ka gitoret piki miten ngi woto ko boto piki tinga mutu ki bori setup kaliet.
Kitu ya kwanza ni tumekuja kuanzia pale Kakuma na mnajua Kakuma is still in Turkana County. Ni origin ya binadamu. Tumekuja back to our roots. Ni Turkana ni the only people ambaye wangali wana share culture na watu wenye walitoka hapa. Tumekuja kuanzia peace hapa sababu gani? Without peace, ingi yetu haitakuwa mzuri. Tumeanzia Kakuma sababu kaunti ya Turkana na serikali ya Kenya walipata kusaidia wale mandugu zetu kutoka South Sudan, kutoka many other countries, kuwapatia mahali ya kukaa. Ndio waangalie macho yao ifunguliwe. The first refugee athletes zilianzia pale Kakuma. Na nataka kusema, I want to say thanks to my head of state, the president of Kenya, for supporting this initiative. Without his support, we could not be here. All along the security team, it is through his leadership. Na nataka kusema again, hii event ni ya charity. Mimi ni mtoto hapa. Tumehudhuria issues ambayo ilikuwa between our community ya Pokot, our community ya Turkana. Kuna issue ya ng'ombe, kuna issue ya climate change vile ndugu yangu aliongea. Kuna shida ya chakula. So kuna shida ya education, atuja catch up na the rest of the world. So wito wangu kubwa ni kukimbia through education, peace through sports, peace through security. Kama Turkana anaweza pewa education because the table of water in Turkana is not far. Tukitoka Kakuma kufika kuna ile fale, I think, yes, a private. If government, and I'm just appealing to the government through His Excellency, if they can do a big mega project for education, our people will have peace. Our kids will go to school. All other people will have food from Turkana. Food ambaye haina chemicals, ambaye watu wa Nairobi watalishwa. And therefore, my painful run is to appeal to all stakeholders in the national world. Also, they need to come and support the community of Turkana because walibeba heavy load. And with the little resources ambaye hao watu wamefanya, nataka kusema asante. And I want to say also, shukran kwa peace ambassadors ya kutoka Turkana County. They have done so much. We started in 2003. Up to today, chairman was Arana, and now today is is our chairman for sports. And tumelala hapa jana mzuri, tumekuwa protected. Now we are on our way to Nairobi and we meet the county government of Pokot. Here tulitoka kwa county government of Turkana.
Otu noton kakito bitu nebo aeng inga musar bolodwa legimiten agenge magenge ngeten komo se jotan po Turkana county ago county sokol jotan ko West Pokot wasingishu ko Kitale anango noton ko Trans Nzoia Nakuru county Baringo county ko Elgeyo Marakwet agetor chiko bor ko musar Nairobi county.
Kwa majina naitwa François Msafiri. Vile mimi ni youth refugee representative in Kenya. Pia mimi ni athlete maratona. Na tumeandaa hii safari pamoja na ambassador Tegla Lerup, refugees team na host community team athlete kwa hii safari ya kueneza amani katika nchi yetu na katika communities zetu sisi wote kwa pamoja. Hapo jana ndio tulianza safari kutoka Kakuma refugee camp na tunaendelea vile mpaka Nairobi kwa kueneza amani katika nchi yetu. Na tulianza hapo jana Turkana, hapo Kakuma na tunamalizia Nairobi Uhuru Park, lakini tunapitia through Turkana, tunafika West Pokot, tunaingia hivyo Trans Nzoia, Wasingishu, Elgeyo Marakwet, tunateremka na Baringo, tunaingia Nakuru, tunaingia mpaka Kiambu County, tumalizie Nairobi. Ya japokuwa mchoko ni mingi lakini safari ni polepole, tutafika. Yes. Hii mbio tumeiprepare kwa muda mrefu sana. Kuanzia January tulikuwa tukiprepare hii mbio. So physically tuko prepared, psychologically, mentally naona tuko fiti kabisa kwa sababu determination ni kusema amani. So ilibidi tu prepare kwa muda mrefu ili tusipate shida hapo mbele, sana mwili na akili. Unajua ndio vina control hii mbio. Haina haja ya speed, just psychologically tukisonga mbele.
Umesema naitwa Gideon Atwere. Nasimamia kitengo cha kikosi cha utawala Turkana Central. Jana tulipata kupokea wageni wetu ambao wanaongozwa na Dekra Rupe ambaye ni foundation yenye inadili na peace. Vile katika kwa hiyo foundation anadili na mambo ya education. Kuna issue ya economic empowerment. So kwangu nitasema machache kwamba through sports vijana wakijiunga pamoja tunawasapata ile amani ambaye ni muhimu sana kwa nchi yetu. Through economic empowerment, maybe vijana wa participate kwa kupanda miti. I mean environmental, ulisema climate change. To participate kwa kupanda miti, especially Turkana. Sababu vile tunaona ukame na sidi na town yetu sana kwa town. Kama tunawasapanda miti ambaye naona wananchi wamechikakamua kupanda, inaweza kutusaidia. Kwa hivyo kwa initiative ya Dekra Rupe, umuhimu zaidi ni vijana wajiunge na sports ili waweze kupata ile pesa ambaye wakati wamefaulu kwenda ng'ambo kuna ile foreign income yenye tunapata through sports. Otherwise, lengo letu kubwa ni kuhakikisha kwamba timu yetu hii tumeisindikiza mpaka tupate kutoka county ya Turkana kwa njia.
Kongeten Turkana Central, Turkana County, Lodwar Town, logo kabeme chipo Kass TV, kegurnon tom chipsoi.
Kong'etege taonit noton nebo Lodwar keweksei nganaset nebo Nairobi asikousing'ong tuyet noton nebo Health Summit netesetai en komosta noton nebo tuyosiek nebo KICC ole kokimit President William Ruto tesetai kobois kot missing en oret nenyolunot tuyet noton nebo SHA neboto kolipan chepkondok chekoyoche alage en sipitalisiek.
And we all know reform is not an event. It is a continuous journey of closing the distance between the promise we made and the experience of every Kenyan who seeks care in all our facilities. Ladies and gentlemen, this summit also comes as we begin a wider national conversation on the Kenya we intend to build beyond Vision 2030. Your contributions over the next 2 days will therefore do much more than improve universal health coverage today. They will help define the healthcare Kenya should guarantee to its people beyond 2030. Serious nations do not start again every 5 years. Governments will change, but a Kenyan's right to health cannot change with them. We can improve what we inherit and correct what does not work, but we cannot tear down progress without an answer for what comes next. Universal health care must become part of our national covenant, not an achievement of a government, a party, or a president, but of the people and of the Republic. That is why the National Development Charter matters, so that our children begin where we finish, not where we began. We have come so far, and we have further to go. Let us use these 2 days to strengthen what we have built, improve what can work better, and safeguard for generations what Kenyans themselves have made possible.
Your Excellency, in August of 2022, the people of Kenya were offered a choice. They were not offered slogans. They were offered a plan, written down, published, in which universal health coverage stood as one of the 5 pillars of our national transformation. Kenyans read that plan, and they give it their mandate by electing you as their 5th president. 4 years later, we have come to this hall to do something that is rare in the politics of our country and in our region. We have come to place that plan side by side with a record, and to invite the whole country to compare the two. And I want to say something about why this was possible, because it is not a technical story we want to say. It's also a political one. Every government that has ever governed Kenya knew what was wrong with our healthcare system. The diagnosis was never a secret, but it is set in reports. It was found in commissions. It was found in expert panels, in the exit notes of the departing officials, including presidents. But what was missing was also never the analysis. What was missing was a head of state willing to spend the political capital.
We have achieved tremendous results over the past 4 years through your leadership, Your Excellency, and through the bottom-up economic transformation agenda, BETTER, which prioritized universal health coverage for all Kenyans. I wish to highlight, but just a few areas that demonstrate the progress we have made, and equally the work that remains before us. In primary health care, over 107,800 community health promoters, CHPs, were deployed under a 50-50 shared financing model between the national and county governments. This has expanded health service availability at the primary level. Primary care networks, PCNs, have increased from 89 to 277. On health financing, Your Excellency, since the inception of the Social Health Authority, counties have cumulatively received 46 billion shillings, out of which 31.4 billion has been paid to hospitals through the Social Health Insurance Fund, SHIF, and 14.2 billion has been reimbursed to primary health care facilities. 98% of public facilities have been onboarded on the Social Health Authority share. Through collaboration between the two levels of government, 32.4 million people have been registered under the Social Health Insurance Fund, representing a significant increase from the 7 million people previously registered under NHIF. Counties have also strengthened emergency response with 304 of our ambulances out of the 506 that we run currently already integrated into the National Ambulance Dispatch System, improving referral linkages and timely response to patients requiring urgent and specialized care.
You don't know when the calamity will hit. Most of us seated here or outside may be healthy. You don't know when the health need will come. Under the leadership of Your Excellency, the President, you have established reforms to turn that promise into a service, and to turn that service to be offered in a manner that does not ruin families financially, and in a manner that does not facilitate families or loved ones to die from causes that we can prevent. Your Excellency, that is the reason why you have directed that we come together as a nation so that we can unveil those reforms that you have established, from the policies to the legislative framework, to the implementation agencies, and to the deliveries. Your Excellencies, you've kept telling us that health should not be a privilege. It should be a right. It's a right that has been enshrined in the Constitution, Article 43, Part 2 of the Constitution.
Kalenjin ki tiyon en nguni rabi mecha much kay tun engete siet na po Kass TV en oret na baka borin ko kinday na umichiro teach kaina nyungo Shadrack Mutai.